Health and culture. How does our culture influence our perception and understanding of health and illness? As a third generation English Australian, I don't immediately identify myself as having strong cultural or religious influences over how I perceive health and illness. But that's just not true. I just share similar views of the culture that I've been surrounded with. We each have our own version of what Hellman termed an inherited lens, through which we view and interpret our world. The idea of health is a construct formed through our teachings and experiences, and we are each, in part, a product of our community's accepted norms. Australia is a multicultural society. In 2020, there were 7.6 million migrants living in Australia, with close to 30% of the total population having been born overseas. So it is clear that our healthcare system needs to be accessible to people of many cultures. Languages, beliefs, religions, and practices vary greatly in our population. Language can be a difficult barrier to overcome in healthcare. The terms used in one language may not have the same translation in another, and medical terms may be complex and alienating if English is your second language. Poor translations can lead to misinterpretations of health messages, directions, and treatment options, impacting the patient's trust in healthcare professionals and their methods. In some cases, there may not even be a translation for the concept being discussed. Religion also influences health choices. Some religious societies have restrictions on medical intervention. Jehovah's Witnesses do not accept blood transfusions, and this is shown to pose difficult ethical issues in emergency situations. Religion might direct modesty practices for women, influencing what healthcare they feel comfortable accessing, and masculine gender roles might see men delay seeking medical attention, seeing a simple problem become a serious one. A person's culture might direct them to alternate healing and rituals that might not align with conventional medicine and could hinder their recovery, creating complex ethical issues for patients and their families. And what is considered healthy in one culture might not be in another. Western society considers a slim figure to be seen as healthy, as obesity is an issue. However, it could be seen as unhealthy to someone who has experienced food scarcity. Western healthcare has expanded to acknowledge and adopt many alternative cultural therapies, such as meditation, acupuncture, energy healing, and yoga. I see this as a brilliant example of how our culture is changing and amalgamating here in Australia. Cultural barriers to healthcare must be strongly considered and our structural systems adapted to overcome them. But I believe that empathy, respect, and compassion are culturally universal and the most vital factors to establish in this process.